The most dangerous thing for the heart after 50 is often not a diagnosis, not age itself, and not even heredity. It is something much quieter, much more familiar, and therefore much more treacherous. It sits in the medicine cabinet at home, in a package a person reaches for almost automatically with complete confidence. I have taken this before, so it must be safe now. And that is exactly where the trap begins. In older age, the heart can lose its reserve strength not with drama, not with a loud warning, but almost silently. First, there's a little more fatigue than usual, then shortness of breath on the stairs, then an unexplained rise in blood pressure, then a night when sleep will not come because of heaviness in the chest or strange irregular beats. And many people never connect these changes with the drug they took, because they are used to fearing cholesterol, stress, weather changes, and age, but not the tablet they believe is harmless. An aging heart does not tolerate carelessness. In youth, the body forgives a great deal. It smooths over mistakes. It carries a person through sleepless nights, heavy meals, stress, extra pills, and neglect. But after 50, and especially after 60, the body stops forgiving so generously. The liver processes medicines more slowly. The kidneys remove them less efficiently. Blood vessels become less elastic. The heart muscle reacts more sharply to chemical pressure. Even the electrical system of the heart, the fine rhythm that keeps life steady and calm, becomes more vulnerable. That is why a medicine that once seemed ordinary can suddenly become a hidden threat. I want you to think about something uncomfortable, but necessary. How many people of mature age take medication not because a doctor carefully rechecked the need for it, but because it has simply become a habit. A neighbor advised it. A pharmacist once mentioned it. It helped years ago. It was always in the house. This is how danger enters the life of intelligent, experienced people. Not through recklessness, but through familiarity, through routine, through that dangerous sentence, "It has always been fine." I have seen this many times in practice. A respectable man in his 70s came to surgery preparation with complaints that sounded, at first glance, very ordinary. Weakness, a strange pressure in the chest, swelling in the ankles by evening. He thought age was catching up with him. His relatives thought he was simply moving less. But when we went carefully through everything he was taking, one detail changed the entire picture. He had been using a common drug regularly, believing it was helping him cope with everyday discomfort. No one had explained to him that in older age this medicine can retain fluid, raise blood pressure, increase strain on the heart, and worsen the course of hidden heart disease. He was not careless, he was disciplined. That is precisely why this subject is so important. Dangerous mistakes are often made by decent, attentive people who are trying to do the right thing. And this is where I want to slow you down for a moment. If you are over 50, your health is no longer protected by good intentions alone. It is protected by accuracy, by caution, by the willingness to question what seems routine. People often tell me, "But I only took it for pain," or "It is sold everywhere," or "Everyone uses it." Yes, and that is exactly why the problem is so large. What is common is not always safe. What is sold without fear is not always gentle to an aging heart. What gives quick relief in one place can quietly create damage in another. Science has been warning us about this for years. In older adults, certain widely used medications can increase blood pressure, promote fluid retention, interfere with kidney function, and place extra load on the cardiovascular system. When the kidneys suffer, the heart suffers with them. When fluid stays in the body, the heart must work harder. When blood pressure rises repeatedly, the vessels stiffen further, and the heart muscle pays the price. This does not always happen in one dramatic episode. Much more often it happens slowly, almost invisibly, until one day a person says, "I suddenly became worse," even though the process had been unfolding for weeks or months. That is why this conversation matters now, not someday, not after another test result, not after another frightening symptom. Right now, because many people watching this are doing something that feels sensible, normal, and even responsible, while not realizing that one familiar drug may be quietly taking strength away from their heart. And the most important point, the one many people still do not know, I will reveal at the very end, because without the full picture it is too easy to misunderstand the danger and make the same mistake again under a different name. You may already be thinking of someone: a husband who keeps tablets near the bed, a mother who says, "It helps, so do not worry." Perhaps even yourself. Perhaps you have noticed that the body now reacts differently than it did 10 years ago. Recovery is slower. Swelling appears more easily. Pressure fluctuates more than before. The heart is not weaker because you have failed it. It is simply asking for more respect than it did in youth. And that respect begins not with fear, but with attention. So let me ask you directly and warmly. When was the last time you looked at every medicine you take and asked not, "Does it help me feel better today?" But what is it costing my heart tomorrow? This is not a small question. For many people, it becomes the turning point between drifting toward heart trouble and stepping back from it in time. Stay with this carefully, because what seems like a simple remedy often opens the door to a much deeper issue, and once you understand that connection, you will never look at common medications in the same way again. If this matters to you, subscribe and leave a like. Do it now, while this thought is fresh, because these calm, practical conversations can truly protect someone's life. And if you know even one person over 50 who keeps medicine close at hand and takes it without a second thought, remember them as you listen, because what comes next is where the real danger begins to show itself. What makes this danger especially cruel is that it often hides behind relief. A person takes something to reduce pain, to loosen stiffness in the back, to quiet aching knees, to make it easier to get through the day, and for a short while it feels as though the body has been helped. That feeling is persuasive. It creates trust very quickly. Pain eases, movement becomes simpler, sleep seems a little more possible, and the mind says, "This is good for me." But the heart does not judge a medicine by how quickly it calms a symptom. The heart judges by what that substance does to pressure, to fluid balance, to the kidneys, to blood vessels, and to the rhythm of circulation hour after hour. And this is where one of the most common mistakes in mature age appears. A person treats pain in one part of the body while quietly exhausting the organ that must carry life through every other part. Very often, the group of medicines I worry about in older patients is the one many people use almost casually for joint pain, back pain, headaches, or inflammation. These anti-inflammatory painkillers are familiar across the world. People know them by different names, but the pattern is the same. A sore knee after a walk, a painful shoulder after gardening, a lower back that tightens in cold weather, fingers that ache in the morning, and a tablet seems like a simple answer. Yet, in an older body, these drugs can do several dangerous things at once. They may cause the body to retain salt and water. That means more fluid remains in the bloodstream and tissues. When that happens, blood pressure can rise. The heart then has to push against greater resistance. At the same time, these medicines may reduce blood flow to the kidneys, especially in people who already have hypertension, diabetes, hidden kidney weakness, or heart disease. And when the kidneys begin to struggle, the body loses one of its main ways of keeping fluid and pressure under control. The result is not theoretical. It is physical, measurable strain. I want you to picture the heart not as a symbol, not as a romantic image, but as a tireless pump inside an aging house. In youth, the pipes are more forgiving. The pump is stronger, the filters work faster, and the walls can handle pressure better. In later life, the pipes are stiffer, the pump has less reserve, and the filters are more sensitive. Now imagine someone quietly turning up the water load while narrowing the passages and dulling the filters at the same time. That is what certain pain medicines can do in an older organism. The person thinks, "I have less pain." Meanwhile, the heart is saying, "I am carrying more than before." I remember a woman in her late 60s who came not because she feared a heart problem, but because she could no longer understand her body. She told me she had become puffy. That was her word. Her rings felt tighter. Her shoes left marks by evening. She was short of breath when carrying groceries. Her blood pressure, which had been fairly stable, had become unpredictable. She was disciplined, sensible, not careless with food, not someone who ignored symptoms. When we trace the story carefully, the change had started after she began taking a common anti-inflammatory drug more regularly for hip pain. No one had explained that in her age group, with her blood pressure history, the medicine could create exactly the chain of events she was living through. Once that link was recognized and the treatment plan was corrected, the picture changed. Not because there was magic, but because the body was finally no longer being pulled in opposite directions. This is one of the reasons experience matters so much in medicine. A younger person may take the same medication for a few days and notice very little beyond stomach discomfort, if anything at all. An older person with even mild hidden heart failure, early kidney decline, narrowed arteries, or elevated pressure can react very differently. The danger is not always visible on the first day. Sometimes it accumulates quietly, a little more swelling, a few more millimeters of mercury in blood pressure, a bit more fatigue, slightly less urine output, a little heaviness in the chest after climbing stairs, nothing dramatic enough to force alarm, yet together these signs form a message the body is trying to send. Scientific studies over many years have shown that non-steroidal anti-inflammatory drugs, especially when used often or without careful supervision, can increase the risk of worsening heart failure, raise blood pressure, and affect kidney function in susceptible adults. That risk becomes more meaningful with age, because aging is not a single problem. It is the meeting point of several small vulnerabilities. The heart is less flexible. The vessels are less elastic. The kidneys are less tolerant. The body contains less room for error. This is why a medicine cannot be judged only by whether it is available without difficulty or whether it worked well in the past. Safety in youth is not proof of safety in later life. There is another point mature people often overlook, and it is an important one. These pain medicines do not act alone. They enter a body that is often already taking other drugs. A person may be on treatment for blood pressure, for arrhythmia, for diabetes, for cholesterol, for fluid retention, for sleep, for the stomach. Add one more ordinary pill, and suddenly you are not looking at a simple situation anymore. You're looking at interaction. For example, an older person taking a diuretic to remove excess fluid and an anti-inflammatory painkiller to ease joint pain may be pulling the body in two opposite directions. One drug says, let fluid go. The other says, hold fluid back. One tries to protect pressure. The other may push pressure up. The result is confusion inside the body, and the heart often pays for that confusion first. This is why I become especially attentive when someone tells me, almost with pride, I do not overuse medicine, doctor. I only take something when I really need it. That sounds responsible, and often it is said honestly. But if, when I really need it, means every few days for arthritis, every bad weather morning for the lower back, every time the knees flare up, then the exposure may be much greater than the person realizes. The body does not count intention. It counts doses, timing, interactions, and vulnerability. Tomorrow, I want you to do something simple and serious. Take every pain relief medicine in your home and read the label slowly. Not quickly, not by habit, but attentively. Ask yourself whether you know exactly why you take it, how often you take it, and whether your doctor knows you still use it. Put the packages in one place where you can see them clearly. This small act alone changes people. It moves medicine out of the shadows of routine and into the light of awareness. Then, for the next 7 days, do not take a pain tablet automatically. Pause first. Ask what kind of pain it is, how strong it truly is, and whether there is another safe way to reduce it before reaching for a pill. That pause is not weakness, it is discipline. And in mature age, discipline protects the heart better than impulsive relief ever will. I know pain is tiring. I know chronic discomfort wears down patience, sleep, mood, and dignity. People over 50 are often carrying pain quietly, without complaint, because they do not want to burden anyone. That is exactly why they become vulnerable to the false kindness of quick solutions. But real care does not only reduce pain for an hour. Real care asks what the price will be in blood pressure, in kidney strain, in nighttime breathlessness, in swelling, in the gradual loss of stamina that people wrongly blame on age alone. And once you see this clearly, another question appears almost on its own. If one familiar medicine can burden the heart not by poison, but by hidden pressure on the whole system, then what sign should make a person stop and pay attention before real trouble arrives? That is where this conversation becomes even more practical, because the body usually warns us in whispers long before it cries out. Those whispers are what too many people miss, and that is often where the story turns. And those whispers matter more than most people realize, because the body rarely begins with catastrophe. It begins with hints. A little swelling at the ankles by evening, a face that looks puffier in the morning, shoes that suddenly feel tighter though weight has not changed very much, a sense that climbing stairs now requires a pause halfway up, a strange heaviness when lying flat in bed, a heartbeat that feels less steady after a few days of taking a familiar pain medicine. None of these signs, on their own, seems dramatic enough to frighten an experienced adult. That is precisely why they are so often ignored. A mature person tends to explain them away with dignity. I am just tired. The weather changed. I did not sleep well. It is my age. But the heart does not speak in polite, theatrical language. It speaks in these small, practical changes. And if you do not learn to hear them, you can walk calmly toward a serious problem while believing everything is more or less normal. What makes this especially dangerous in later life is that the warning signs overlap with ordinary aging. That is why intelligent people miss them. They are not foolish. They are simply too reasonable. They look for the simplest explanation. A little less energy must be age. Slight swelling must be salt in yesterday's dinner. Slight breathlessness must be lack of exercise. Yet medicine teaches a stricter lesson. When a new symptom appears after a new tablet, or after a familiar drug begins to be used more often, that connection must be treated with respect. The body is not being dramatic. It is reporting. And in cardiology and heart surgery, some of the worst trouble begins when a report is dismissed because it sounds too ordinary. I remember a retired engineer who came to me with an almost apologetic attitude. He was not the type to complain. He had spent his life solving problems, enduring discomfort, and staying composed. His blood pressure had been acceptable for years with treatment. He had some stiffness in his back and knees, like many men his age, and he had started taking a common anti-inflammatory medication more frequently after doing repair work around the house. He did not come because of pain. He came because, as he put it, something about my stamina has become unreliable. That phrase stayed with me. He was not panicking. He was observing. He told me that a short walk no longer felt as easy, that by evening his socks left deeper marks than before, and that on some nights he felt as if he needed one more breath before sleep would settle. To many people, that would sound vague. To an experienced doctor, it sounds like a system under strain. And indeed, when we examined him properly, the issue was not imagination, not laziness, not just age. His body was retaining fluid, his pressure control had worsened, and the medicine he trusted for pain was part of the chain. This is where mature viewers need to understand something deeply important. The heart does not suffer only from dramatic enemies. It also suffers from repeated small burdens. Think of carrying groceries. 1 light bag is nothing. 2 are manageable. 3 are unpleasant. But if every day you carry a little more than your frame can comfortably bear, sooner or later your shoulders, your back, your breathing, and your balance begin to change. The heart works in much the same way. A little more fluid, a little more vascular resistance, a little more kidney strain, a little less oxygen reserve, a little more pressure at night. Each burden may seem minor. Together, they become the difference between stable health and a body that starts slipping. There is also a dangerous psychological trap here. When a tablet relieves pain, a person becomes less likely to question it. Relief creates loyalty. That loyalty can be stronger than evidence. I have seen patients defend a drug that was clearly harming them simply because they feared the return of pain more than the hidden strain on the heart. That is human. Pain narrows thinking. It makes today feel more urgent than tomorrow. But wise medical care must always protect tomorrow. A medicine is not truly helping you if it makes your joints more tolerable while it quietly increases the work of your heart, disturbs your blood pressure, or pushes a vulnerable kidney closer to failure. Science supports what long clinical practice teaches. In older adults, especially those with hypertension, prior heart disease, heart failure, diabetes, or reduced kidney function, The regular use of certain anti-inflammatory pain medicines is associated with fluid retention, rising blood pressure, reduced kidney perfusion, and higher risk of cardiovascular complications. Even people without a known history of heart failure may reveal a hidden weakness when the body is forced to hold more fluid or when treatment for blood pressure becomes less effective because another drug is working against it. In simple terms, the medicine can make the body less cooperative. It becomes harder to keep pressure under control, harder to maintain balance, harder for the heart to do its work without paying a price. And this is why the early signs must be respected. Not feared blindly, but respected. If you notice swelling that was not there before, do not call it a trivial inconvenience. If your pressure becomes harder to manage after you begin taking something for pain, do not assume the blood pressure treatment suddenly stopped working. If you wake in the night with an odd sense of pressure or feel you cannot lie flat comfortably, do not explain it away too quickly. If your endurance declines in a matter of days or weeks rather than slowly over years, that is not something to dismiss with a shrug. The body is often more precise than we are. There is another subtle clue older people often overlook. Pay attention to how your body behaves in the late afternoon and evening. Many cardiovascular problems begin to show themselves there. Rings become tight. Lower legs feel heavier. Breathing feels less effortless after supper. The body does not recover from a small task as quickly as it did even a month ago. You may not feel sick, but you no longer feel quietly stable. That loss of quiet stability is one of the most valuable warning signals in mature medicine. It means the body is spending more energy just to remain balanced. Tomorrow, do one exercise that may seem almost too simple, but I assure you it is clinically useful. In the morning, look at your ankles, your hands, and your face in a calm, attentive way. Notice how your shoes feel. Notice whether your rings slide normally. If you have a blood pressure monitor at home, check your pressure at the same time each day for the next 7 days, especially if you have recently been taking any pain medicine more often. Write down not only the numbers, but also how you feel. Heavy, clear, short of breath, swollen, restless, tired. This is not obsession. This is observation. A good doctor can help you much more effectively when you bring a pattern instead of a vague memory. And you yourself may notice a connection that has been hiding in plain sight. I want to say something slightly strict here, because it needs to be said. Many people over 50 are very disciplined with food and very careless with tablets. They will avoid butter, count salt, worry over one slice of cake, and then take a medicine for pain several days in a row without once asking what it does to blood pressure, fluid retention, kidney blood flow, or the effectiveness of their heart treatment. This is not because they do not care. It is because society has taught them to fear food more visibly than medication. Yet for many older hearts, the tablet is the more immediate threat. A dinner can be corrected. A hidden drug interaction may continue silently until the body is pushed beyond its reserve. I have also seen the opposite mistake, and it is equally unfortunate. A person begins to feel swelling or breathlessness, but instead of questioning the pain medicine, they assume they need more tablets for blood pressure, or more diuretic, or something stronger for the heart. So one medicine causes strain, and another medicine is added to control the consequences, while the original cause remains untouched. This is how older patients gradually collect prescriptions without anyone stepping back and asking the simplest question of all: what changed first? In medicine, chronology matters. The body often tells the truth in the order events appear. There is a kind of wisdom that comes with age, and it deserves to be used here. Mature people know that life rarely collapses all at once. More often, it goes slightly off balance, then a little more, then more still, until one day the difference cannot be ignored. The heart is very often the same. Trouble arrives in steps. The wise response is also step by step. Notice, record, compare, question, correct. This is how serious illness is sometimes prevented before it needs drama to be believed. And now we are approaching an even more uncomfortable layer of this subject, because the medicine itself is only part of the story. There are certain people for whom this risk becomes much higher, sometimes dangerously higher, even when the dose seems ordinary and even when the use is not constant. These are the people who most often say, "But I only took a little," not knowing that their body belongs to the exact group that can least afford such experiments. If you recognize yourself in what I have said so far, stay close to this point, because the next step is where many hidden heart problems stop being hidden. If this conversation is helping you see your health more clearly, subscribe and leave a like now. Do not postpone it, because practical medical guidance should reach people before the warning signs become emergencies. And if there is someone in your family who says, "It is just a simple pain pill," send this to them when the time is right. A quiet correction today can spare a great deal of suffering later. And the people who fall into that higher risk group are often not the ones who feel especially ill. That is one of the bitter ironies of later life. The most vulnerable patient is not always the one lying still, pale and frightened, fully aware of danger. Very often it is the man or woman who still functions, still goes to the shop, still cooks, still drives, still keeps the household in order, and therefore assumes that the body is coping well enough. But hidden vulnerability does not always announce itself with weakness. Sometimes it hides behind habit, endurance, and a face that still looks composed. This is why certain medicines become especially dangerous in older adults who say, with complete sincerity, "My heart is fine as far as I know." In medicine, those last 4 words matter greatly. There are several kinds of people I become particularly concerned about when I hear that they are using anti-inflammatory pain medicines regularly or even from time to time without much thought. The first is the person with high blood pressure, even if that pressure seems more or less controlled. Many mature adults think of hypertension as an old companion, unpleasant but familiar, something that belongs to life now and can be managed well enough with tablets. But pressure control is not a small technical detail. It is the daily mechanical reality under which the heart and blood vessels must work. When a medicine pushes that pressure upward, even modestly, it does not simply change a number on a screen. It increases the force against which the heart must pump. In a younger body, that strain may be absorbed more quietly. In an older body, especially where arteries are stiffer and the heart muscle is already working with less reserve, that extra load may be exactly what turns stability into trouble. Then there is the person with diabetes. Many people understand diabetes mainly through sugar, diet, and nerves in the feet, but they do not always appreciate how deeply it can affect the blood vessels, kidneys, and heart over time. Diabetes does not merely change laboratory values. It can make the entire cardiovascular system more fragile, more sensitive, less forgiving. So when a diabetic patient takes a medicine that may reduce blood flow to the kidneys or promote fluid retention, the issue is not isolated. It enters a body whose internal balance is already more delicate. That is why a tablet that seems ordinary on the surface may carry a very different weight in a person with diabetes than in someone younger and healthier. I am equally cautious with anyone who has even the mildest sign of kidney weakness. And here the problem becomes more serious, because many older adults do not know how well or how poorly their kidneys are working. They may feel no pain, no obvious symptom, nothing dramatic at all. Yet kidney function may already be reduced simply because of age, long-standing hypertension, diabetes, vascular disease, or years of ordinary wear within the body. The kidneys are not noisy organs. They do not complain early, but they are essential partners of the heart. They regulate fluid, salt, and pressure with a precision most people never think about until that precision is lost. If an anti-inflammatory medicine reduces kidney blood flow, even for a time, the result can be more retention of salt and water, higher pressure, more swelling, and more work for the heart. In an aging system, this can happen faster than people expect. There is also the person with a history of heart trouble that seems old, and therefore, in their mind, no longer urgent. A previous heart attack years ago. An episode of heart failure that improved. A stent placed long ago. A valve problem that is being watched. An irregular rhythm that comes and goes. A murmur the doctor once mentioned. These details matter enormously, even if life feels normal now. The heart remembers. It may recover function, adapt, stabilize, and continue faithfully for years, but it does not become new again. A heart with history is a heart that deserves protection from hidden burdens. In such people, the line between tolerance and decompensation may be much thinner than they realize. I once saw a man in his early 70s who had done remarkably well after treatment for coronary disease. He had worked hard to improve his habits. He walked regularly. He was proud, and rightly so, that he had regained much of his stamina. His appetite was good, his mood was good, and he considered himself almost back to normal. Then arthritis in his hands began to trouble him, especially in the mornings. He started using an anti-inflammatory pain medicine because he wanted to keep active. It seemed sensible. It allowed him to button his shirt more easily, grip things better, and move with less irritation. But within a short period, he felt heavier, less clear, less steady on exertion. His pressure became more variable. He had the vague sense that something was off, though he could not define it. What had happened was not mysterious. He had not suddenly become lazy or anxious. The medicine that helped his hands had placed stress on a cardiovascular system that had reserve, but not limitless reserve. Once the right connection was made, the situation improved, but the lesson remained. A medicine may not need to be toxic in order to be dangerous. It only needs to push the wrong body in the wrong direction. There is another group that must be mentioned very plainly, because too many people in this group still think they are simply tired or out of shape. I mean those with hidden or early heart failure. Not the dramatic image many people imagine, not a person gasping desperately in a hospital bed, but the quieter form that often begins with reduced stamina, swelling by evening, needing an extra pillow at night, or feeling unusually winded after familiar effort. These people may still work, travel, cook, socialize, and look entirely ordinary, but their heart is already living closer to its limit. For them, even a small tendency toward fluid retention can be significant. Even a modest rise in blood pressure can matter. Even a small reduction in kidney support can shift the whole system. This is why a familiar pain tablet can be the match that reveals dry wood already lying there. Science repeatedly confirms what experienced clinicians observe. The risk from certain anti-inflammatory drugs is not distributed evenly across all people. It rises sharply in those with pre-existing cardiovascular disease, heart failure, kidney disease, hypertension, diabetes, and in older adults taking multiple medications that affect circulation, fluid balance, or kidney function. In practical language, the older and more medically complex the person is, the less room there is for casual experimentation. This is not a call to fear every pill. It is a call to stop assuming that common use means personal safety. There is also the question of combinations, and here I want you to listen especially carefully. Many mature adults take a blood pressure medicine, a diuretic, and perhaps another medication to protect the heart or kidneys. Then they add an anti-inflammatory drug for pain. This combination can create what some doctors know as a particularly risky situation for kidney function and fluid balance. You do not need the technical term to understand the danger. One medicine relaxes the system in one direction, another removes fluid, and the added pain medicine interferes with the body's compensation. The kidneys receive less helpful blood flow, fluid regulation worsens, and the heart is left to cope with the consequences. What the patient feels may simply be swelling, fatigue, dizziness, or reduced stamina. But behind those ordinary complaints, the physiology can be moving in a very unfriendly direction. This is why I become strict when an older person tells me they use pain tablets only when really necessary. But they cannot remember exactly how many days a week that means. Memory is not enough here. Precision matters. A vulnerable heart does not care whether your intention was modest. It responds to what entered the bloodstream, what the kidneys had to manage, how the pressure shifted, and whether the body could restore balance afterward. Mature medicine is not based on vague impressions, it is based on patterns, and patterns are often clearer than people expect once they begin looking honestly. So tomorrow, I want you to do something more specific than before. Make a simple written note of the conditions you already have, even if they seem mild. Write down whether you have high blood pressure, diabetes, any known kidney issue, swelling in the legs, a history of heart problems, irregular pulse, shortness of breath with exertion, or the need for a diuretic. Then place next to that list every pain medicine you use, even occasionally. Look at the page and ask a sober question. Am I someone whose body has less margin for this drug than I assumed? Keep that note for 7 days. During those 7 days, pay attention not only to pain relief, but to the whole body. Are you more swollen, more breathless, more tired, less steady, more variable in pressure? This kind of observation can prevent a very expensive mistake. I want to say something important to those who are proud of their endurance because many people over 50 are exactly like this. They do not like to fuss. They do not run to the doctor for every symptom. They endure pain, pressure, and discomfort quietly. That dignity can be admirable. But when it comes to medication risk, endurance can become a trap. The body may be struggling while the character remains composed. A person who has learned to push through discomfort may not notice how much their internal balance has changed until the shift becomes too large to ignore. Quiet suffering is not the same as safety. And there is one more group I do not want to leave out. Those who are caring for someone else. A husband giving his wife something to help her joints. A daughter handing her mother a familiar pain tablet because she used to take it before. A son assuming that if a medicine is sold everywhere, it cannot pose much risk. Family love often acts quickly, generously, and without enough suspicion. But after 50, and especially after 65, kindness must become more informed. Relief offered without understanding can sometimes do harm with the best intentions in the world. This brings us to another layer that people rarely consider until trouble has already begun. It is not only who takes the medicine that matters, it is also how long, how often, and under what false sense of safety it is taken. The body can sometimes tolerate a brief exposure and then recover. But repeated use, creeping use, the sort of use that becomes part of ordinary life without anyone naming it as regular use, that is where hidden damage often grows. And once that pattern settles in, people stop seeing the medicine as an active factor at all. It becomes invisible. It becomes part of the furniture of life. That is when risk deepens most quietly. If you are beginning to recognize yourself or someone close to you in this picture, stay with it. The next step is not merely about which people are vulnerable, but about how misuse becomes routine, how short-term relief becomes a long-term habit, and why that habit is so difficult to notice until the heart begins to complain more loudly. That is where the subject stops being abstract and becomes painfully real. And that slow, creeping habit is exactly where so many careful people lose control of the situation without ever making what they would call a serious mistake. Nothing dramatic happens at first. No one announces, "Now, this has become dangerous." A tablet is taken on a difficult day. Then again after a poor night of sleep because the shoulder hurt. Then after a walk because the knee complained. Then because the weather changed and the joints began to ache before morning. Little by little, relief stops being an exception and becomes a pattern. And once a pattern forms, the mind stops seeing it clearly. It no longer feels like active treatment. It feels like part of ordinary life. That is why mature people so often say, "I do not really take it regularly," while the body has already been living under its influence for weeks. This is where I want to bring everything together very calmly and very clearly. The real danger is not just one tablet. It is the illusion of harmlessness. It is the belief that a familiar drug cannot possibly be the reason the pressure has become unstable, the legs have begun to swell, sleep has become heavier, or the usual walk now takes more out of you. People expect danger to look dramatic. They imagine a severe pain, a collapse, an ambulance, a moment that is impossible to ignore. But medicine after 50 often works differently. The body first loses comfort, then reserve, then resilience. The tragedy is that many people notice only the last stage, while the first two were already warning them. Now I can say the most important point directly, the one many people truly do not know. The harm is often not caused by the pain medicine alone, but by the fact that in older age it works against the very treatments that are trying to protect the heart, blood pressure, and kidneys. This is the secret many mature patients have never been told in plain language. They think they are simply adding one small pill for pain. In reality, they may be quietly weakening the effect of their blood pressure treatment, increasing fluid retention despite a diuretic, burdening kidneys that were already working with less reserve, and forcing the heart to compensate for all of it. In other words, the medicine does not always attack the heart directly like a poison. Sometimes it does something more deceptive. It removes the conditions the heart needs in order to stay stable. That is why the problem is so often missed. A person looks at the situation and sees separate issues. Pressure has worsened. Breathing is not as easy. Swelling has appeared. Fatigue has increased. Perhaps the doctor needs to change the heart medicine, increase the pressure tablet, add another diuretic. But before all of that, the wiser question is often much simpler. What common thing entered this system and quietly pushed it off balance? In older medicine, the right question can be more valuable than an extra prescription. I have seen this lesson repeated many times. A patient comes frightened by the idea that the heart is suddenly failing. They imagine the worst. Yet when the story is carefully untangled, there was often a very ordinary beginning. Pain in the joints. A few more tablets than usual. A belief that something available and familiar could not matter very much. Then small bodily changes were explained away because they seemed too ordinary to deserve suspicion. By the time the connection is finally recognized, the person is often shocked. Not because they were irresponsible, but because no one ever taught them that in later life the body is less forgiving of hidden contradictions. The heart can endure a great deal, but it pays dearly when one treatment is trying to stabilize the system while another is quietly undoing that work. This is why I do not want you to leave this conversation merely worried. Worry by itself is not medicine. Awareness is useful only when it leads to action, and the action here is not complicated. It begins with honesty. You need to know exactly what you take, exactly how often you take it, and exactly why. You need to stop judging a medicine only by whether it relieves discomfort quickly. After 50, the better question is whether it allows the whole body to remain stable tomorrow, next week, and next month. Fast relief is attractive, but stable circulation, protected kidneys, controlled pressure, and an unburdened heart are worth much more than an hour of easier movement bought at the wrong price. For the next 7 days, I want you to treat your medicine routine with the same seriousness people usually reserve for test results. Put all your pain medicines in one visible place. Write down the names. Write down how often you actually use them, not how often you think you use them. Note your blood pressure if you monitor it. Notice swelling in the legs, heaviness in the evening, breathlessness on stairs, tight rings, restless sleep, or a reduced ability to lie flat comfortably. And then, most importantly, bring that information to your doctor or pharmacist and ask a precise question in plain language. Is this pain medicine safe for my heart, my kidneys, and my blood pressure at my age, with my conditions, and with the medicines I already take? That question alone can change the entire direction of a person's health. I also want to leave you with something encouraging, because mature viewers deserve truth, but they also deserve hope. The body after 50 is more sensitive, yes, but it is not helpless. I have seen people improve remarkably once one hidden burden was removed. Pressure becomes steadier. Swelling recedes. Breathlessness eases. Sleep becomes deeper. Walking feels lighter again. Not because time turned backward, and not because medicine performed a miracle, but because the body was finally allowed to stop fighting against itself. That is the bonus many people do not expect. When the harmful pattern is broken, the gain is often felt not only in the heart, but in clarity, stamina, mood, and confidence. A person begins to feel more like themselves again. And that matters deeply because the real value of protecting the heart is not just avoiding hospitalization. It is preserving ordinary life. It is being able to walk without fear of sudden heaviness, to wake without swollen hands, to move through the day without that constant sense that the body is laboring too hard, to stay independent, to remain useful in your own home, to keep dignity not only in years, but in the quality of those years. Time at this stage of life is too precious to lose to a preventable mistake hidden inside a familiar habit. So remember the chain in its simplest human form. Pain asks for relief. Habit offers a quick answer. The aging body pays a hidden cost. The heart begins to whisper. The wise person listens before the whisper becomes a crisis. That is the entire lesson. Not fear, but attention. Not panic, but discipline. Not endless tablets, but careful choices made with respect for the age and experience your body now carries. And if you have listened this far, take that seriousness one step further. Do not keep this only for yourself. Share it with the person who says, "It is just a common painkiller." Share it with the one whose ankles swell by evening. Share it with the mother who reaches for a familiar tablet without looking at the label. Share it with the father who says he is simply getting older when in fact his body may be asking for help more clearly than he realizes. These quiet conversations save people because they catch the truth before the body is forced to shout. Subscribe and leave a like because clear, calm medical guidance is needed now more than ever, especially for people who have spent a lifetime taking care of others and too little time questioning what may be harming them. Hold on to this thought. Growing older is not a reason to surrender strength. It is a reason to protect it more wisely. Your heart does not ask for perfection. It asks for respect. And when you give it that respect, day after day, choice after choice, you give yourself the best chance to live not only longer, but steadier, calmer, and with the kind of energy that still allows life to feel truly yours.